This program is brought to you by Presto Personalized Wonders.
Mayam Bukrumzari Adam Nemribasi Impact News ni I Joyshree Usham na Impact News ki Impact Health Link for a Healthy Manipur program asda taram nokchari. Ngasigi episode asida akoina thyroid cancer amading nuclear medicine ki matangda khangminashi aduga ngasigi episode asida expert oina lengchin biriba koi guest na Dr. Arivan Ramachandran, consultant nuclear medicine AOI Babina Specialty Hospital, Sajiwa Jail Road, Khabeisoi. Dr. Arivan completed MBBS from Jimpmer Puducherry, and he has further completed MD Nuclear Medicine from PGI-MER Chandigarh. And Dr. Arivan is a nuclear medicine specialist proficient in scanning and interpretation of PET, CT scans, nuclear cardiology and nuclear medicine therapy. Dr. Arivan has also won KGS Nanda Gold Medal Award in Neurology. Thank you so much, Doctor, for taking the time to be with us here today.
Good evening.
So today, Doctor, we're going to discuss about thyroid cancer and the relation with nuclear medicine. But first of all, could you please highlight what are the roles and function of thyroid gland in a human body?
Okay, thyroid gland basically secretes a hormone called thyroxine, which makes your metabolism in the body regulated, and it also accentuates the function of other hormones in the body. Like it helps the adrenaline hormones to work properly. It also maintains your body temperature. It increases your gastric outlet and everything. It is a hormone which is responsible of taking care of multiple other hormones also. But for layman terms, they can understand that thyroid function is mainly involved in regulating body metabolism.
Okay, so if anything happens to the thyroid gland, then all this metabolism could be impacted.
Yeah.
So in the case of thyroid cancer, what are the signs and symptoms of thyroid cancer?
Usually thyroid cancer presents with a swelling in the neck. They might be having it for years or months. And the danger signs are when it is increasing in size rapidly over a small period of time instead of a long, like some people, if you see, they'll have swelling for 10 years, 15 years, which is not increasing in size. Even though it's a risk factor, the danger signs are if the course is very short and it's increasing in size rapidly, then you have to get it checked. First, they'll evaluate using an ultrasound. Then if there is suspicious node, then we call it a nodule, the swelling. If there is a swelling in the thyroid gland which is suspicious, we'll go ahead with an FNAC, then which can prove whether it is malignancy or not, which is cancer or not.
Okay, so when you said swelling of the thyroid gland, so will it be visible here on the neck or is it?
Okay, thyroid gland is like a butterfly shaped gland which is located anteriorly in the front part of the neck.
In the front part
of the neck, but it's not necessarily you'll always have swelling in the front. You can have swelling in the right side, left side, because when cancer happens, cancer also spreads to surrounding areas. So surrounding areas, there are some anatomical structures called lymph nodes. I don't know the exact Manipuri term for that, but there might be swelling in other areas of the neck, which can also suggest there is some pathology going on underlying. It's not necessarily in the anterior, but usually it comes in the front part of the neck, but it can also happen in the other side.
Okay, so what are the risk factors for getting thyroid cancer?
So risk factors include iodine deficient diet. In hilly areas especially, people have iodine deficient diet, and having Hashimoto thyroiditis. There is a autoimmune condition where your body thinks that your thyroid gland is an outside thing and it starts attacking it. It's very common among women. So Hashimoto thyroiditis can increase the chance of thyroid cancer. Around 5 to 38% is associated with thyroid cancer. Apart from that, thyroid cancer risk can be due to radiation exposure. Sometimes people who work in radiation field, who are exposed to X-rays and other stuff frequently, who are like traveling in aeroplanes a lot, they are exposed to more radiation, they can also have higher chance of developing thyroid cancer.
So that means pilots and cabin crew, they have high chance of getting thyroid cancer?
Theoretically, yes. Yeah.
Okay. So apart from cancer of the thyroid, is there any other thyroid related disorder which might have similar symptoms but not cancer?
Yeah, and there are benign conditions like goiter, There is toxic nodule, non-toxic nodule. What we call toxic nodule and non-toxic nodule is there is a swelling in the neck, but that is not a malignancy, but it is doing some other function, like it can produce thyroid hormone at a higher rate,
Okay.
which can cause other symptoms. Heart rate can increase for those patients. There can be non-functioning node also, which is non-malignant. That is also very common, and it's common in places, especially in hilly areas where iodine deficient diet is common.
Okay.
We call it goiter, because of which there will be a swelling of the thyroid gland, and there can be nodules, there can be cysts in the thyroid. But those again are risk factors for thyroid cancer, but they can be benign also. That's why we go for FNAC to prove whether it is a malignancy or not.
So since you have mentioned in hilly areas where there is iron deficiency diet,
Iodine deficiency.
iodine deficiency. Okay. So what is the frequency or of thyroid cancer in Manipur?
In Manipur, in men, 1.1 in 1 lakh people in male population have thyroid cancer. In female population, it's higher. It's 4.7 per 1 lakh.
Why is it higher for women?
Women are more prone for Hashimoto thyroiditis, as I said earlier. They are more prone for that autoimmune disease, and hence they are more prone for thyroid cancer. That's a suspected theory. We cannot prove why sex preponderance is there, but one related factor is that Hashimoto thyroiditis is more common in women. Especially you can see, like even my mom has Hashimoto thyroiditis. She has hypothyroidism, subclinical hypothyroidism. Hypothyroidism is when thyroid hormone is produced less than required by the body. So those Hashimoto thyroiditis people will have hypothyroidism. Those people are more prone for thyroid cancers than normal people.
But
so it's
they are
more
prone,
common in
but
women.
it's not compulsory that they would get.
Yeah, it's not compulsory they would get. It's just a probability. The probability is high for them and probability is low for others.
And then doctor, women after certain age, like middle-aged women, people often say that women tend to have thyroid related problems. So is this what you are talking about? Or
Yeah. This is one of the main causes. There are other causes also. It's common in India mainly because of we are not used to following it up regularly. In foreign countries they follow up regularly, and Hashimoto thyroiditis, for some reason it's very common in India also.
And then doctor, once what is thyroid cancer different from grave disease?
Yeah, grave disease is when your thyroid function is above the normal limit. It is producing more thyroid hormones than required by the body. So the symptoms of that will be a bit different. There will be swelling of the neck, which won't be very small or something. There will be gross swelling, a bigger swelling, diffuse swelling in the neck, in the anterior region. That means in the front of the neck. The patient will also have palpitations, like heart rate will be very fast. They'll feel that their heart rate is very fast. They'll have weight loss. They'll have diarrhea. It's all because their thyroid hormone is produced in high amounts, and because of which her other hormones are also functioning at a higher rate. Okay, so there is basically a high production of the thyroid hormone and underproduction. Higher production.
Like there are two types of.
Yeah. There is underproduction, there is higher production. Underproduction is more common in women. Higher production can happen in anyone. That is also like a bit more common in women.
So this both hyper and hypo, both this, if it is prolonged, it can they can become cancer or not?
Hypo is more associated with cancer. Hyper is not associated with cancer much. But yeah, even if there are within hyper there are certain classifications. Example, Graves' disease. There can be a thing where as I said earlier, toxic nodule. One nodule will be there in the thyroid gland, which produces more thyroid hormones. Other parts of thyroid gland will be fine. In Graves' disease, what happens is whole thyroid gland is hyper functioning, but there can be situations where only one nodule is hyper functioning. So there are certain classifications. Those you have to really go into the scientific details for it. But in a general term, you can understand that thyroid disorders can be of two types. One is hyper, one is hypo. Hypo is more common in women, and then hyper is what we call the most common hyperthyroid state is Graves' disease, where there will be diffuse swelling in the front of the neck, and for that we have to do two tests to confirm it. We have to first check whether thyroid hormones are higher or not first. we'll check that. Then if it shows higher, to confirm it, we can do by two methods. We have to check antibody level, TRAB antibody we call it, or by a nuclear medicine scan, thyroid scan we call it. It's here we do 99M technetium thyroid scan. These two things can confirm the diagnosis, and based on that they can start the treatment.
Okay, and then hypo is more related to the cancer.
Yeah.
Now, doctor, once in both the case there will be swelling of the throat. So, will there be any pain associated?
Most cases won't have pain associated with it, but there can be instance it's more common as not painless swelling.
Painless swelling?
Yeah, more than painful swelling. There can be instances where it will be painful, but mostly it is painless swelling.
Okay, so painless swelling for quite some time, then the patient has to go to the doctor and get it checked and confirmed. And in case if it happens to be, or if it is diagnosed to be thyroid cancer, then what is the treatment procedure?
Okay, first once we confirm the thyroid cancer by FNAC, the first option is to go ahead for surgery. But before that, I'd like to clarify that thyroid cancer can be of different types. Not all thyroid cancers are same. There are differentiated thyroid cancers, there is poorly differentiated, there is anaplastic carcinoma.
So 3 different types?
Mainly, broadly, 3 different types are there. Within differentiated thyroid cancers, there are multiple categories, but poorly differentiated and anaplastic carcinomas, they have a different course. But for all of them, the main aim of treatment is first surgery to remove
any thyroid cancer, surgery is the first option.
Yeah, surgery is the first option. Either if it is in a stage, based on the stage we will decide. If it's in the lower stage, expected to be in the lower stage, we'll go ahead with removing just a part of the thyroid gland, one part of the thyroid gland. But most of the cases will require complete removal. So there will be complete removal of thyroid gland.
Okay. I'm just curious, if the entire thyroid gland is removed, then what will happen to the metabolism of the hormone?
A good question. So that's when we give thyroxine as a supplementation to those patients. Since there is no thyroid gland in their body, there is no production of thyroid hormone, we have to supplement it from outside.
Okay.
So thyroxine we give depending on the dose. For thyroid cancer patients, we usually give 2.5 times their weight. So if a patient with 50 kg comes, we give them 125 micrograms, so that the cancer doesn't grow. These cancers use thyroid hormones to grow. So we want it not, don't want that, so we give a higher dose. They don't use thyroid hormones, they use another hormone which influences thyroid hormone. So we don't want that influencing hormone to be high. So to suppress it, we give a higher thyroid hormone from outside. Okay. So it should be taken on empty stomach half an hour before breakfast with normal temperature water.
This is after surgery?
Yeah, this is after surgery.
So when it comes to nuclear medicine and treatment of thyroid cancer, how is it,
where does it play a role?
How is it applicable?
So after surgery, in differentiated thyroid cancer and poorly differentiated thyroid cancers, the main course of treatment is radioiodine. In poorly differentiated cancer, radioiodine can or cannot be used, but mainly in differentiated thyroid cancer, the only role next is there is no chemotherapy or anything immediately. The first procedure is to treat the patient with radioiodine. So once the thyroid gland is removed, we will do a diagnostic scan. What we call a diagnostic scan, it's a radioiodine scan where we'll give a small amount of radioiodine to the patient. It will go and accumulate in places where there might be disease. Sometimes during surgery, the whole thyroid gland cannot be removed because it's a big structure. So some part of thyroid gland can be left out in the post-surgical area. So we give a small amount of radioiodine to ablate that, to finish it off, kind of. So depending on the stage, depending where it has spread, sometimes patients can have lymph nodes, as I said earlier. So in those cases, we'll give a higher dose. It can spread to lungs, it can spread to bones. So depending on the spread, we'll decide the dose and we'll treat them with radioiodine. And it can be given every 6 months based on the patient response.
So how serious is thyroid cancer? Like, what are the staging, and is thyroid cancer, after surgery curable, or, depending on the stages, there is chances of different life expectancy?
Yes. In stage 1 and 2, till 3 it's curable, but once it goes to stage 4, the curable becomes a question. In usually thyroid cancers, 5-year survival rate is, for differentiated I am talking about, is 96 to 98%, which means a patient who has a thyroid cancer has a chance of 5-year living is 98%, and it's almost
That's
curable.
very high.
Yeah, for any cancer, because thyroid cancers are usually slow growing cancers, so it's not a very morbid condition or so, but once it reaches stage 4, the question of survivability comes. Then we cannot, we won't be saying curability, we'll be saying like prognosis, so it'll drop down to 60-50% like that.
Okay. So till stage 3 it's curable and life
Not exactly like that, there are some intricacies to that also.
Okay.
It depends on their age, it depends on their how they respond to radioiodine and everything. It's not clearly classified like that, but for your understanding I'm telling till stage 2 it is like you can consider it curable, but after that it's like grey area where we have to depend on the response and everything.
Thank you so much, doctor. We'll take a small break here.
Yeah.
Matang aswaida tinba commercial break talawjage break matungda thyroid cancer madi nuclear medicine ki matangda khangmina kishi.
Adom kalen gi maisa maragda asumna humai humaga leiba pambibra natraga asumna nungaine AC manungda relax tawraga adom gi daily thabak tawba pambibra asumna relax oina thabak tawbiningrabadi mezo hapta AC brand makhal suna leizare loan gi khudong chabasu leizagani akupa marol gi damak lengsan biraksi mezo hab kaisampat konjing hazari lekai opposite Sangai Express.
Maidigu Institute of Aviation and Hospitality, Changangai Airport Road, Imphal. Admission open for new batch 4, Commercial Pilot License Training, Certificate Course in Air Hostess Training, Diploma in Airport and Airlines Management, Diploma in Hotel Management, and BVoc in Hotel Management. For more details, please contact the numbers shown on the screen. Maidigu Institute of Aviation and Hospitality.
Imung umada changma polamsing Pena store da fangdab leitre. Grocery items, cosmetic items, sena chana ba firo. Electronic items, home appliances, loina na furniture items.
Isagi apamba polamsing leibada dukan amada mukchat amada mukchen tawgi mathau tadre.
Hojik oirakliba leiba isan mitlon gi fibam yengjaraga Pena store yonjari ba polam kodima ki offer pijari. Sagolban babdong mantri lekai Imphal West amadi Salam Awang lekai Sangai Tel Road Imphal West ta lengtong piraktuna polam kodima leiba gi nungaiba mahau lobi ho.
This program is brought to you by Presto Personalized Wonders.
Breaking matungda amka na taram nokchari ngasi akoina impact news ki impact health link da khanarim topic asi thyroid cancer madi nuclear medicine matang dani aduga hiramasida takwi tambiriba khoi expert guest na Dr. Arivan Ramachandran, consultant nuclear medicine AOI Babina Specialty Hospital, Sajiwa Jail Road, Khabeisoi degi. Doctor, after the break we would like to know more about the treatment for thyroid cancer. Like you have mentioned about using radioactive iodine treatment. So how is this treatment applied, and then is there any side effects from this treatment?
Okay, radioiodine comes in liquid format. So you basically drink the medicine. So it's radioactive, so you need to follow certain precautions after drinking it. Once the patient receives the treatment, they have to be isolated, or if they don't have a separate room, maintain 6 feet distance from pregnant ladies and children for a particular period of time, usually 1 to 3 weeks. And because they'll be emitting radiation from their body, so that should not affect children and the pregnant women. So we ask them to stay, and for with adults they should also maintain some distance for 4 days, at least 6 feet during the night, and during daytime they should not spend prolonged time with other people. So they have to maintain some restrictions. Side effects of radioiodine, they can have salivary producing glands in the body can have swelling sometimes. They can have gastritis, stomach burning sensation. They can have vomiting sensation. Almost 30% of the patients have it. So we'll give pre-medications to that, to like tablets to prevent it. So it's not an issue. Apart from that, if they are taking radioiodine for a prolonged period of time, like some patients can receive every 6 months higher doses. those patients can have problems of infertility if they cross a certain period, certain amount of radioactivity.
Okay.
They can have sometimes have bone marrow suppression. Your bone produces blood cells, so sometimes it can get suppressed and your blood cells can fall down thoda, which can also be corrected. Usually it is temporary, but sometimes it can happen permanently, and there is less than 1% chance of your lungs getting like crumpled, like, but it's a lesser chance, and higher the dose the chances increases.
Okay, so these are some of the side effects.
Side
So doctor, I'm curious, after this, you said surgery is required for all types of thyroid cancer. So why chemotherapy is not given, and why radioactive is given instead of chemotherapy?
Yeah, radioiodine is given because thyroid cancers are shown to take up radioiodine, and they respond better to radioiodine, and there is no chemotherapy that will be taken up by the tumor cells, the cancer, as much as radioiodine can take. It can take up radioiodine. It takes up radioiodine more than the other chemotherapy agents. So it's easier for it to kill the tumors. Radioiodine can easily kill the tumors cancer better than the chemotherapy agents. But once, sometimes what happens, the tumor might not respond to radioiodine. Radioiodine will not have an effect on the tumor. Those cases we try giving chemotherapy.
Okay, but in most of the cases,
They will
radioactive is recommended.
Yeah, radioactive iodine is.
Okay, what about iodine therapy? Is it same as radioactive iodine treatment?
Yeah, it's same as radioactive iodine treatment. We just have, for better understanding, we say it iodine therapy.
Okay.
We better to call it radioiodine therapy. Yeah.
So now when the patient is under radio or iodine therapy, they have to be isolated, and so this has to be given in the hospital premises only.
Yeah, it can be given only in hospital premises because radioactivity procurement and other things, other people won't have the what to say, they don't have the permission to give such things.
So
we need special equipments and everything.
All this setup and facilities available at AOI Babina Hospital.
Yes, yes, yeah. All the facilities are available related to radioiodine in AOI Babina hospitals.
Okay, what about the cost of this treatment?
It depends on the dose we give, and it's covered in CMHT and PMJY schemes.
Okay, this the thyroid cancer is covered.
Yeah. So for scan and treatment, we have different costing prices. I think scan is around 13,000. Treatment prices depends on the amount of activity we give.
And then cardholders will have their own benefits.
Yeah, they'll have their own benefits.
Okay. And then doctor, one more thing. After the surgery, depending on the stages, how long the person has to go, the patient has to go undergo this radioactive treatment?
Yeah, you usually give every 6 months. Depending on the response, once the patient becomes cured, we won't repeat, we won't be giving it anymore. But our aim is to cure the patient once. So it will be given every 6 months. Maximum we can give is like, we call it millicurie, the activity ka dosing we call it millicurie. So once the patient crosses 800 to 1000 millicurie, we won't be giving anymore. But
anymore in his or her lifetime?
In her life. Maximum we can give is around 1 curie. After which we won't prefer giving radioiodine. But usually it's every 6 months, and depending on the response we'll decide, and usually most people will respond in 1 or 2 cycles. Yeah.
Okay. So once the patient gets treated, like what is the chances of getting relapse, or is there no more chance because the gland is already removed?
That's a good question. There is always a chance of recurrence. So we have risk classification: low risk, intermediate and high risk. That will depend on the patient response, and during surgery they will have some parameters. After surgery, the whole thyroid gland is being removed. They will send it for biopsy report. So in that biopsy report, we will know that patient is under low risk, intermediate or high risk. So that classification by itself will tell high chance of recurrence, intermediate or low chance of coming back. So based on that, we will give treatment, and following that, once the response is seen, if the response is not seen, based on that also we will classify again as high, low or medium risk. then we will see whether the chance of recurrence is there or not. If high patients, the chance of recurrence is always high, around 30% it is.
So doctor, if a woman, if she gets thyroid cancer and her gland is removed, then she cannot become pregnant again, right?
It's not like that. She cannot become pregnant again or anything. Every 6 it's better to wait after she receives a treatment. If for example, if she receives the treatment today, it's better for her to wait for 6 more months before she can conceive her.
So during that 6 months course, she'll be given thyroxine.
Yeah, thyroxine.
So like external thyroxine can help. So she can still conceive because
she can still conceive. Yeah. Even if her whole thyroid gland is removed, external thyroxine is enough for her to conceive.
Okay. What about since it's related to many hormones? Do patients with thyroid cancer or even after removal, do these patients have lots of mood swings or other psychological related issues because of the neurotransmitters?
Yeah, sometimes what happens when we ask the patient to stop thyronome, we ask the patient to stop thyronome before giving radioiodine therapy. For 3 to 4 weeks they have to stop the thyroid hormone. During that time, patient can have low mood, they can have weight gain, they can have swelling of face and limbs, they can have constipation. Those are common symptoms, but we can counsel the patient enough so that they don't feel that something is wrong with them. There is a chance of low mood when the patient is not taking thyronome. Yes. So those things can be managed with counseling. There is no extra special concern required for that.
Okay, so now that we have come towards the end of this program, I would like you to give some suggestions about diet. What kind of food should be taken to avoid thyroid cancer or thyroid related problem, and preventive or healthy foods for thyroid gland.
Yeah, mainly hypothyroidism is common for one more reason. There are foods which are more they are called goitrogens. They have higher chance of causing hypothyroidism. Those type of foods can be reduced in your intake. Example, cabbage, cauliflower, all those have certain components in them which can cause hypothyroidism more. So it's better to take those type of foods less, and you can do other variety of fresh fruits and vegetables. Instead of including cabbage, cauliflower in every food, you can shift to some other vegetable which is more palatable.
What about meat and like intoxicants, alcohol and tobacco?
All those have smoking, alcoholism, eating smoked meat or fish have higher chance of causing cancer. Yes, so it's better always to avoid them, or if you cannot avoid them, take in lesser quantities, smoked fish and meat.
Okay, thank you so much, doctor. Any other take home away message that you would like to give to our audience?
I have seen many patients from my personal experience. They have swelling for like 10 years, 5 years. They don't go get it checked in the neck.
Because it's not painful.
It's not painful and it's not causing any symptoms. So I want those people at least to go show it to a doctor, get an ultrasound done, and if possible an FNAC. Once it is proven it is not a cancer, then you can be at peace, instead of ignoring it for years and then coming later when it has spread to every part of the body.
So better to get it checked and then confirmed rather than waiting for the last stage.
Yeah, and women, please check your thyroid hormone levels so you can
especially
know
women.
Yeah.
Okay. Thank you so much, doctor. Doctor, this program is sponsored by Presto Enterprises. It's a shop which deals with memento and certificates and gift items. So this is from Presto and Impact News to doctor as a thank you. Thank you so much.
Thank you.
Thank you so much for sparing your time. Ngasigi Impact News ki Impact Health link matang aswai loisilakle. Ngasigi episode asida akoina thyroid cancer amadi nuclear medicine ki matang da khangminakre. Mathangi chayolda atopa laina amagi matang da Dr. Ama Pudan lakchage haraga miyam dagi kaina naba yathang ijari. Thank you.
ꯄ꯭ꯂꯥꯟ ꯑꯃꯒ ꯂꯣꯏꯅꯅ ꯂꯥꯛꯂꯤꯕ ꯖꯨꯟ ꯑꯃꯗꯒꯤ